Hello, everyone, and welcome back to MediInsights. Today we explain Beclomethasone Inhalation, a preventer inhaler used to control asthma and reduce flare-ups. Stay with us for clear, practical guidance on when to use it, how it works, dosing tips, side effects, and essential safety advice. Right now, let's start today. Let's go over the main reasons doctors prescribe beclomethasone. Beclomethasone inhalation is mainly used as a preventer inhaler to control long-term asthma symptoms and to reduce airway inflammation, and it is sometimes used in chronic obstructive pulmonary disease for selected patients. You do not use it to treat a sudden asthma attack because it works slowly to reduce inflammation rather than quickly opening airways. Your clinician prescribes it when you have frequent wheeze, need regular reliever inhaler doses, or to reduce flare-ups over time. Now we'll explain the recommended dose and schedule. A common starting regimen for adults is 1 to 2 puffs twice a day, with usual starting totals around 200 micrograms twice daily, and higher maintenance doses used only under medical supervision for more severe asthma. Children's doses are lower and depend on age and the specific inhaler device, so always follow the prescription and the patient leaflet for the exact micrograms per puff. Do not change or stop the dose suddenly without checking with your doctor, because steady daily use is what prevents symptoms. A quick note on how beclomethasone works at a basic level. Beclomethasone is an inhaled corticosteroid that works locally in the airways to reduce inflammation by suppressing inflammatory cells and mediators, which lowers airway hyperresponsiveness and helps prevent wheeze and breathlessness. Because it acts mainly at the site of inhalation, systemic side effects are less common than with oral steroids, although they can occur at high doses. It may cause reactions in some users. Here's what to expect. The most common problems are local, such as throat irritation, hoarseness, and oral thrush, which appears as a white coating or soreness in the mouth. Serious systemic effects like Cushingoid features or adrenal suppression are uncommon with usual inhaled doses, but become more likely at high or prolonged doses, so report weight gain, mood changes, or unusual tiredness to your doctor. If you develop signs of allergy such as swelling, rash, or breathing difficulty, stop and seek urgent medical help. Last but not least, important advice for safe use. Use your inhaler every day as prescribed, even when you feel well, because consistent use prevents future attacks and reduces inflammation. Always rinse your mouth and spit after inhalation to reduce the risk of oral thrush, and consider using a spacer device with a metered-dose inhaler to improve delivery and lower mouth deposition. Keep a reliever inhaler with you for sudden symptoms and never use beclomethasone as a rescue treatment. Review your inhaler technique with a pharmacist or nurse if you are unsure. Thanks for watching. If this helped you understand beclomethasone inhalation, please subscribe to MediInsights and leave a question or comment below. Share your experience with inhalers, and hit the bell to get future practical medical videos from our channel today.